Hello, my name's Steve Hodgson. I'm Director of Hallamshire Physiotherapy, which is a physiotherapy-based clinic in Sheffield. What I'm going to talk today to you about is leg length discrepancy. This is where people present with back pain often, or pain in their sort of thoracic spine or even neck, and are told that the main problem is that they've got one leg shorter than the other. Well, I have some doubts about the sort of usefulness of this diagnosis. A, it's not a diagnosis, and B, within 2 centimetres is often seen as normal in terms of leg length anyway. So there's no hard and fast evidence whatsoever to suggest that having a leg length discrepancy is going to give you back pain. Now, if you think about it, one of the problems is how do you measure this? It's very hard to accurately measure if one leg is longer than the other. Because what happens, and you can see from here, the pelvis here, the position in which your pelvis is in will make a huge difference to how your legs will actually appear. Now, if your trunk is twisted, it will look like you've got one leg longer than the other. So we will get what is known as an apparent leg length discrepancy, when in fact all it is a twisting of your trunk. And from my clinical experience, most of the problems that we see are related to twisted trunks because people work at computers, so they become asymmetrical, they walk dogs, they run around tracks one way, they get into habits, they limp different ways, and that produces a twisting of the trunk, which then gives them an appearance that they've got one leg shorter than the other. They haven't. When you put the trunk in the right position, the apparent leg length discrepancy goes, and they're back to normal. Yeah, so you can change it anyway. Now, if you're going to measure the legs, you've got to use radiographs. You've got to really accurately measure the hip, the knee, the ankle, and see if there's any discrepancy between them. And in a few cases, you will see people who've fractured legs in the past and will have one leg longer than the other, but they don't necessarily get back pain because our bodies are designed to function. If we've had a leg length discrepancy and from a fracture, as long as it's not too excessive, we'll find our body will adapt to that, we'll be happy, fine, and away we go. We won't necessarily have any long-term problems. And there's no evidence to suggest that having slight discrepancies in leg lengths will cause any ongoing back pain. So it's sometimes used as a way of frightening people without any real justification. Now, if you do have a leg length discrepancy, you'd expect your symptoms to come on when you're walking. You'd expect when your pelvis is tilted, because one leg is shorter, that's when you're getting your back pain. Well, a lot of the people I see don't necessarily get pain when they walk. They get it when they're sitting, so it doesn't really matter a great deal what your legs are doing. You're not standing up there, so there's no tilting the pelvis anyway. So you've got to think about when you get your symptoms, and if the symptoms are not coming on walking, you really have to think, well, is this related to leg length discrepancy? So when we look at people, you've got to look at what's happening with the trunk, and you've got to then consider, do they have a significant leg length discrepancy which seems to be changing their symptoms? And in most cases, it is not. People get put into orthotics to tell them they've got to have this leg longer than the other. Well, if it's going to work, it should work within a few days, a week. You should feel quite significantly better if it's going to make a difference. However, from my experience, it doesn't work. Don't bother putting orthotics in. 9 times out of 10, I remove them anyway. Your body's adapted to this discrepancy. If there is one over the years, you've often just sprained your back and you need to take the stress off the spine, start to use it properly, and they get better. Once you start telling people that they've got a leg length discrepancy, well, what are you going to do? You're going to spend the rest of your life having built up shoes or going to have your leg lengthened. It's not feasible, and it doesn't help patients, it just frightens them. So there's no evidence to suggest that leg length discrepancy makes a difference long term. You've got to look at why you get your symptoms, you've got to look at the position of the trunk, and you've really got to consider if that centimetre difference between one leg and the other, is it clinically relevant? Well, often it is not clinically relevant, and it just frightens people. Take the orthotics out, use your back correctly, start to activate it, and see a physiotherapist who you get recommended to yourself, who knows what they're doing in terms of the global impact of back pain. There are many more important factors that give you back pain than looking at leg length discrepancy. It is not the main thing, however it's used as a way of frightening people. Okay, thank you very much. If you require any further information, please go to our website. It's www.hallamshirephysiotherapy.com, or ring us, and we're more than happy to answer any questions you may have. Thank you very much.